Now I'm going to go fast. So Linda did a very nice job of setting up the HEAL initiative, and this slide just gives you a very good snapshot of this $500 million program per year that we're implementing very rapidly, going from discovery to preclinical to clinical to implementation. And I'll focus on where our institute is really playing a prominent role is in the pragmatic aspects of this HEAL initiative. So this just didn't come out of the blue. You've heard about the NIH Collaboratory. It was established in 2012. We've learned a lot about how to do pragmatic trials embedded in healthcare systems, and this is really where the rubber meets the road. We're doing research in real time, engaging healthcare delivery organizations as research partners. So they're part of the solution, they're part of the research, they're part of the team. And through these 8 years of the Collaboratory, we really developed a handbook on how to do clinical trials in real time in healthcare systems, and I encourage you to look at the link at the bottom of this slide. So based on that experience, then, we were really quite poised to move forward with a HEAL initiative that took all this experience into what we're calling pragmatic and implementation studies for the management of pain to reduce opioid prescribing. And this is really, again, a learning healthcare system. Studies must be embedded within healthcare. They will use a coordinating center that's critically important in helping these projects get to their milestones in their planning phase of these projects. And they will really address three key issues here. Systems change to improve adherence to evidence-based guidelines for pain management. We heard a lot about that from Roger and others this morning. Integration of evidence-based approaches for pain management into healthcare systems. We've talked, I think, all day about this in terms of how do we do our best jobs of integrating non-pharmacological approaches into healthcare systems to improve their effectiveness. And critically, we're also partnering with CMS to do trials that will directly inform their national coverage determination decisions, which is critically important in terms of reimbursement. So these notices are already out on the street. The notice of intent to publish has been published in November 2nd. We're hoping the FOAs will follow very soon. The first is what I talked about, this idea of doing implementation and pragmatic research across a broad array of evidence-based approaches within a healthcare system. The second approach at the bottom here is much more targeted. This is looking at acupuncture for the treatment of chronic low back pain in older adults. There is currently not enough evidence that this approach is effective in older adults. There's a lot of evidence in younger adults. So this is really where CMS is asking us, and we are more than happy to do this, is work with them to provide the evidence for coverage determination that could lead to reimbursement. So that's the HEAL initiative. In a similar vein, using the Collaboratory model, we've also launched the NIH DoD VA Pain Management Collaboratory. And this, again, is to conduct large-scale pain management research in a pragmatic way in the military and healthcare systems. And we've been very successful in launching 11 demonstration projects. This is the 2-year planning phase where the Coordinating Center has been very instrumental, I'll talk about that in a minute, in helping these projects get to that point where they can be implemented. We've also built in an implementation project, so we're building the track as the train is moving down to the station, in the sense that we're doing the pragmatic research, but we're also thinking about methods to implement once these trials are completed, and if they show efficacy or effectiveness, how do we best implement them? So at the heart of all this is the Pain Management Collaboratory Center. It's run by Robert Kearns, who you know very well, and others. It really is where these demonstration projects work in project teams to develop and initiate and implement the research protocol. The coordinating center really helps convene a steering committee that keeps everybody informed. It's really supporting the demonstration projects in real time, working through all the issues around design. Electronic health records, make sure the correct data is available for these particular research projects. And ultimately, the goal for the center is to disseminate best practices and really change health care as we know it. And we're also hoping that not only will this apply to the veterans and the DoD healthcare systems, but the lessons learned can be applied more broadly to civilian and private practice as well. But we do a lot more than just the Pain Management Collaboratory and the HEAL. We also have a very robust clinical research pipeline, and these are the funding opportunities that can really take someone from translational or basic science translational all the way through to pragmatic. You can see the approaches for mind-body that I've talked about, and depending on where you are in your research, there's a mechanism for you. Not to say you have to go in order, but I think it gives you an idea of how you can sort of structure your research moving from translation to pragmatic. Not to forget that half our investment in NCCH is also in natural products, and there we mentioned the cannabinoids and some of the mitragynine, a constituent of kratom, for example, have been shown to be somewhat effective analgesics, and we're also interested in natural products research as well. And I think that's all the time I have.